Hi, my name is Jade Faris. I'm a nursing student, and my project was increasing the implementation of non-pharmacological pain management in the emergency department. Understanding that about 80% of patients that come to the emergency department report complaints of pain, and as much as 60% have pain as their chief complaint. So from this, I devised a bunch of interventions to increase the implementation of non-pharmacological pain management. This was a two-pronged approach to the project. The first was educating the nurses about the benefits of the interventions and how to implement them. The second was encouraging the nurses to implement them and increasing the availability of resources in the emergency department. Some significant findings of the project were increased familiarity and comfort from the nurses in implementing these. That was also reflected in my chart audits. So I had 4 patient groups, all of them in pain. One of them had no intervention, one of them had medications only, one had non-pharmacological interventions only, and then one had both non-pharm and medications. And that group had by far the most significant decrease in pain, followed actually by the group that only received non-pharmacological interventions with a stronger pain decrease than even the medication group. So very promising results that will contribute to some very impressive changes in the emergency department.
My name is Gracie Mitchell, and I am a nursing student. My research is focusing on the implementation of a turn team to prevent hospital-acquired pressure injuries. Pressure injuries are also known as bed sores. They are especially critical in intensive care patients due to their increased likelihood of friction, shearing, and immobility. These can cause detrimental effects to the patient, such as infection, and they also cost the hospital up to $151,000 per injury. So we are looking for a way to help reduce those numbers that was cost effective to the hospital and would also prove to be helpful for patients and for staff. So the method that I chose was to create a turn team, which is a teamwork based approach to ensure that patients are going to be turned every 2 hours. This assigns 2 nurses to the even hours of the shift to go and turn all of the patients that are deemed appropriate for turns, evidenced by my educational flyer that I gave to all of our nurses and staff on the unit. These results showed that patients were turned way more frequently. Prior to my intervention, I found that while most patients' turns were being charted in our electronic medical record, most of these turns were not actually being completed. And after my intervention, way more turns were being charted along with way more turns observed to be completed, which resulted in way more patients being repositioned and much better post-survey results stating that they were more comfortable repositioning their patients and that they knew what a turn team was and how it could positively affect the unit.